Hello, it's Dr. Rhonda Johnson. Today's Friday, April 1st, 2022, and today I'm discussing hair loss following COVID-19 infection. Well, the topic of hair loss or alopecia has been in the news quite a bit lately, so I thought I would discuss this because alopecia or hair loss after COVID-19 infection is very common. But first, there are many causes of hair loss. It can be hereditary, chronic illness, nutritional deficiency, hairstyles that put a lot of tension on the hair, overuse of chemicals, heat, or harsh hair treatments, many reasons. But hair loss or shedding is common after fever, after illness, even after emotional stress or any shock to your system. And it can happen at any age, and it can happen equally to males and females. Now, the medical term for this is Telogen Effluvium. That means when the hair goes into a resting phase after the ratio of usual actively growing to resting hair is reversed. Now, when does COVID-related hair loss usually start? Typically, it can start anywhere from 3 weeks to 3 months after having COVID, and even after having mild COVID. Now, for some people, it occurs all of a sudden. They're in the shower or brushing their hair, and then the hair comes out in clumps. Now, for black women, it doesn't matter if your hair is chemically relaxed or if it's natural. You can still lose your hair. And for black women, the pattern of hair loss tends to be in the center of the head, although the reasons of this is not understood well. Now, this hair loss can last for 6 to 9 months after COVID before it stops. And then people start to see their hair look normally again and start growing. And again, it's just the body's way of dealing with the stress that COVID places on your body. Again, even if you think you have mild disease. Now, is hair loss a side effect from any of the COVID-19 treatments? That's always a rumor on social media, but the truth is no, it's not related to any treatment for COVID. It's caused by Telogen Effluvium. And again, that process of changing the proportion of hair that's in the active growth to the resting phase. Now, what can you do? If you want to spend a lot of money trying to get your hair to grow back, please know that all those fancy treatments may not help. Eventually, your hair will grow back on its own. But you can take steps to decrease stress, and I know that's easier said than done, and you want to do it in a healthy way. And you want to take care of your hair by avoiding hairstyles that pull on the hair, avoiding excessive chemicals or heat treatments to the hair, and make sure your diet is healthy and contains good sources of protein and the normal recommended daily allowance of vitamins and minerals. That's my message today. As always, my views are my own. Take care.